In today's video, I'm going to walk you through how to do a well child visit for a 4-month-old. If you're new here, welcome. I'm Liz. I'm a family nurse practitioner, and in this series, we're doing health assessment. So I have some previous videos on newborns and 2-month-olds and the well child check that goes with those. So if you haven't seen those, maybe skip back over to those. But we'll just be going over, like I said, my general how I do a well month check on a 4-month-old. We do have a volunteer for today's episode, and that is my daughter. Just a side note, as we go forward, as in the other videos, I will be keeping her in a onesie during this because it's the internet. But if you were doing this out in the real world, you would be doing most of this physical exam part down when the baby is just in a diaper until you do the peri area check, and then you would pull the diaper down for that, obviously. But this would be done, the physical exam would be done when the baby is just in a diaper. That way you can get a better look of the baby, but that's not what we're doing here today. So let's jump right into it. So this is another appointment that we will start with some measurements. We're gonna check the baby's length, we're going to check the baby's weight, and we're going to check the head circumference. And we will put that onto the graph that they hopefully have their newborn 1-month and 2-month assessment charted onto, so we can kind of see how their growth curve is looking. Fun little facts here, BMI can't be calculated yet because you can't do that until they have a height, and they don't have a height yet, they just have a length. And the growth charts that you should be using here is the World Health Organization charts for length, height, weight, all those things. Now, for the sake of this video, I'm gonna kind of flip-flop it. In my real life, I will say I do the physical exam last. That way I can look for things. If concerns or anything came up, I can look for physical things of that. But for the sake of today's video, it's flip-flopped and we're just gonna roll with it. Let's jump into the physical exam. Okay, so again, when we are looking at our 4-month-old baby, we're doing exams much like we did in the 2-month and the newborn visit. So if you need another refresher, you can go back and look at those videos. I'm just gonna kind of do a really brief overview since we've already covered that pretty much the same exam in the last 2 videos. We'll let Piper keep her toy in hopes that she is happy. Again, I film these with their clothes on. If you were in the provider's office, you would have babies stripped down to just a diaper so that you can really look over them. First thing you always do in a physical exam is you just look. How does baby look? Do they look healthy? How's their skin? Do they have any skin lesions? Do they have any birthmarks? And if they so, are they changing? Are they the same? What's going on with those? As you can see, Piper has hyperpigmentation on the bridge of her nose right here. This is actually lightening. She has a different mark on the nape of her neck that's staying the same, and that's expected to stay the same for the rest of her life. Just make sure nothing new is there, that they don't have any signs of infection or anything else you're worried about. She also has some atopic dermatitis on her cheeks. So something like that, any different type of lesions on their skin, just note and provide whatever guidance is necessary for the parent. We also still like to look at their head shape. Look at it from the top down and from the side. Make sure that it's not too flat. We would expect a tiny bit of flatness in a baby this age because again, they're still on their back a lot of the time. But since they are becoming more mobile, we would expect for their head to be rounding out, and you never want it to be totally flat or flat on one side. Things like that you would need a little bit more of a workup for. So a nice round head is the goal. A little bit of flattening, okay. Other things I've kind of looked at when I just walked in and looked at the baby, you know, skin color, does that seem appropriate for their race? How's the baby's tone overall? You know, you don't want them, at this point, they should be able to move pretty freely. You want to see that both limbs can kind of move independently of each other, that they're gaining a little bit more control over their arms. Their movements are not very spastic, but they do move all of their limbs. So you don't want them to be super duper tight, all squished up in a ball, but you also don't want them to just be laying there super duper floppy. So this is kind of a good example of a baby that should be like kicking around, kind of a little bit active. They're moving a lot more when they hit this 4-month mark. I like to assess also at this point how baby is interacting with parent. Maybe you took the baby and you put them up on the exam table. Is baby still following the parents with their eyes? That's a good sign. You want babies at this point to be looking to their parent or caregiver for reassurance, comfort, and safety. Okay, so we've looked at baby, decided they look lovely. Now we're just gonna take a quick peek in the ears. Again, remember when you're doing pediatric assessments of the ears, you pull up and back so you can see it in their ear canal real well. Good job. And then you do the other side, up and back. If the ear assessment, as always, is something that really annoys baby, you could do that at the end. Piper doesn't seem to mind, but if that it does annoy baby, do it at the end because you don't want them screaming. It's gonna make the rest of the exam very difficult. See if we can get in their mouth. Good job, honey, good job. assess, just shine the light in their eyes and look for the red light reflex. Perfect. To give everything just a good little tickle and feel. That's usually a good time to see. Babies around this age should be laughing out loud. Not necessarily a lot. Piper is not a huge giggler, but this is a time that you can try to see if you can get a giggle out of them. You might not be able to. That might be a thing that just the parents can do, but it's something I always usually like to try to do, is just squeeze in a tickle while you're just feeling their neck and make sure everything feels okay there. Next, we're gonna move down on the chest and we're just going to listen to these little hearts. And again, you'd be doing this right on the skin. Then we'll switch over and we'll listen to some lungs. And during this physical exam, one other tip I have is most babies will not just lay on the exam table for a stranger and let them check them out. In that case, have the parent hold them and do the exam that way. Totally fine, and you can usually get a much better listen. Next, we're gonna move on to the belly. We'll listen first. Always listen before you touch. Good, and then we wanna feel the belly and make sure it's nice and squishy. This whole time we're also just looking at the chest, making sure the shape is right, everything looks fine there. We're just moving down the body. So we're gonna go here, we're gonna feel the femoral pulses, make sure that they're equal, feeling their tone in the legs. Yes, girly. If you would like, you could always check for hip dysplasia again. So you can do the Barlow and the Ortolani, and then moving down to the cute piggy toes, you just wanna make sure the hands and the feet have good color. They seem to be circulating well, nails look fine. After we've completed this part of the physical exam, I usually do a quick diaper check. So I'll just unbutton their diaper, make sure everything looks okay in the diaper area. And this is just looking for any signs of anything abnormal or rashes. A lot of the times parents won't bring up rashes to you, and you'll just be able to see like, ooh, baby's got a yeast rash or something going on down there. And you can counsel them on how to treat that and avoid it in the future. All right, so now we have the physical exam done with the baby. Let's talk really quick about the milestones that you would be expecting to see in a 4-month-old baby. So a 4-month-old baby, you would typically expect to be able to giggle. So you would usually ask parents like, have you seen them laugh? Another thing that they should do is they should look to their parent or caregiver for reassurance or anything, like fairly often just checking in. You'll just see them looking at the parent, checking in, making sure everything is okay as they're in this new environment. They should also be able to receive some assurance for parent. So if they're looking at them, they're kind of apprehensive and the parent is like, hey, yeah, everything's fine, giving them a smile, baby should kind of calm down a little bit, or even if parent has to pick them up and give them a pat, baby should be consolable by the caregiver. Baby should also be talking a little bit. They don't have to make a ton of noise, but they should be making some kind of babbling, bah, coo. Usually it's not too jabbery at this point, but it's usually like bah, 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 that kind of noise. And when you make those noises at them, bah, they should turn their head. They should be curious. They should be wanting to turn around and look at you. You might hear my daughter downstairs making those noises right now. In terms of what they can do physically, babies should be able to prop themselves, kind of push themselves up on their hands, and they should be able to do this from their stomach. And at this point, we would typically see some rolling skills starting to develop. Most babies around 4 months of age can roll from their stomach to their back. Not all can necessarily go from their back to their tummy, but you would expect to see at least some kind of rolling or the indication that they're thinking about it right around the 4-month mark. And the last big milestone we're looking at here is kind of their hands. Newborns keep their hands so fisted, and a 4-month-old should kind of have their hands a little bit more relaxed. They should be grabbing at things. They should be moving things across the midline. They should be wanting to manipulate objects, but being able to loosen their hands and tighten them in a somewhat purposeful way. They should also be playing with their fingers, maybe putting them in their mouth. And the final thing you want to check for is, does baby grab with both hands an object and hold it at midline? So that's what this looks like. You're just sitting there and you're like, if I was a baby, that's what that would look like. And there you go. Those are the big milestones we're really looking for at a 4-month visit. Next, we just move into questions. Do you have any questions for me? You can even leave the appointment with that. Next, I like to go over some safety stuff. Is your baby traveling in a car seat that is still rear facing that you have not added any paraphernalia to? You should not buy anything at a store and put it into your car seat. That is not safe. I usually review, once again, you guys know I'm like really hardcore about my car seat safety. I worked in peds and saw some things. Chest clip needs to be at the line of their underarms and quite snug. Next, safe sleep. Are they sleeping in their own sleeping area without any blankets? They can be using a sleep sack. Sleep sacks are great. I usually recommend those to them. No stuffed animals, no crib bumpers. It's just you, the baby, if they're wearing a sleep sack, the sleep sack, and then the mattress and crib and a sheet and a crib protector. I guess that was dramatic, but nothing needs to be in the crib. Great time to talk about food. Do you have enough access to food for baby? If parents are using formula, do you have enough money to afford formula? Usually this can even be on an intake sheet when they come in. Do you have any questions about food, anything like that? Breastfeeding, do you have enough access to food? Do you have any issues with breastfeeding? Do you feel like baby's getting enough? This is also a good place to talk about babies eating real food. Some organizations say that 4 months is okay. I usually tend to go with the American Academy of Pediatrics recommendation. I think in the World Health Organization that says like 6 months. So that is usually my recommendation, is wait till 6 months to start baby on solids. Obviously you do you and you go by whatever your healthcare provider wants, but personally that's usually what I recommend, is more at the 6 month mark, which is different from how when we were raised. So there's a lot of usually questions regarding like, well, my parents said this. And so there's just a lot of education sometimes behind that of like, it's okay to wait till 6 months. But obviously they're the parents, they can do what they want and you're the healthcare provider and whatever you feel is right. Further moving along in terms of anticipatory guidance, kind of what parents can expect and be looking out for here. You can talk about some play. What do you like to do with your babies? Here's some things that your baby is going to start to want to do in the next couple of months, like get down on the floor with them. We really are going to see a huge burst in their motor development, moving and manipulating objects. Give them something to chew on. They're going to start to really be interested in teething, trying to roll. They're going to want to start to sit up. So encourage all those activities in them. Get down on the floor, do all of that. Still really avoiding screens if you can. Books are a really fun thing to introduce. They have no idea what you're talking about, but they might like being able to follow the pictures, and that still develops awesome language skills that can be shown later on down the line that you're starting now. Bedtime, nap time, all of those routines, I usually like to ask about those. Do you have a consistent routine that leads up to bedtime? That can hugely help with recognizing like, okay, this is time for me to sleep. If not, anything as simple as we change your diaper, we get you in your jammies, we read a book or sing a song, we snuggle for a minute, and then you go down to bed. It doesn't have to be a whole thing, but I think establishing a routine, if you don't have one yet at this age, is great. And to wrap up some anticipatory guidance with parents, it's letting them know baby is, like we talked about, gonna get a lot more mobile. So you're really gonna have to be careful. Maybe before you could leave them on the middle of your bed and then walk out. That's not gonna be a go anymore. Baby's gonna roll off. No couches, no beds. They need to be on a safe spot on the ground where they can't fall anywhere, because you'll come into your room one day and boom. And no one wants that. Also, all the small objects that siblings or you might have laying around the house, it's a good time to start actually baby-proofing your house, because they're just the most curious little things, and they're gonna be able to start to move, and they're gonna be able to get things, and now they can put them in their mouths. They can get all the things in their mouths, so it's time to start staying away from small objects, putting sister's Legos up a little bit higher and having a special place where she can play with them, but baby can't. And never, ever, ever leaving baby alone in a tub or around any body of water, sink, anything, bucket, anything like that. And then the very last thing at the visits we usually do is go over the recommended immunizations, and I use the CDC's recommended immunizations. So at this appointment, they would be getting the rotavirus, DTaP, Hib, pneumococcal, and polio. If it happens to be flu season and parents ask, babies cannot get the influenza vaccine until they are at least 6 months old, so they are not eligible to receive that at this time. And then one last thing to just keep in the back of your mind, again, I know I've said it in the other two, is just look at how baby and the parent are communicating. Look at how the parents look like they're doing. Do they look like they're ready to pull all of their hair out? Assess how the parent is doing, how comfortable they feel, how do they handle stressful situations with the baby. When baby gets fussy, what usually calms them down? Little questions like that can help you assess how do we have a handle on this situation, and anything you can provide, any support horses, social work, anything like that, if it seems like the situation is just a little bit more stressful than maybe it would ideally be. But you'll get a vibe on that as you go. Again, make sure you're addressing those parents' questions and any concerns that they may have. But that is my basic 4-month well visit in a nutshell. Make sure to check out those first two if you haven't seen them already, and stay tuned for our 6-month well checkup. Subscribe so you can see more videos like this. Thanks so much for hanging out with me today, guys, and I will see you next time. Bye.